Yeah. Hi, can you hear me? Great. So one more and you can have a break. Great introduction. Thank you. So Lee Cameron, and the project that I was involved with for my practicum was very interesting, and the ending was in a report for the agency. The agency that I was working with was the United Church Hospital Health Services in the Hazeltons. And this, can you see this? The quote? Hopefully I'll say it correctly. The Gitsan Magical Gali X, and this translates from Gitsan into flowers along the rivers, flowers pertaining to the children and youth that live within the Gitsan territory of where the Hazelton communities, where this project, where it resides. And that, what was provided by Dr. Jane Smith. Thank you, Jane. So the development of a process to build a collaborative community youth mental health plan, what I and my practicum supervisor referred to as the planning before the planning, satisfied many levels, not only just for my organization that I was sitting my practicum at, but it's a strong interest of mine. I was born and raised in Gittimax, and very cognizant of the variety of good things and not so good things occurring there. This report is also timely because there's been much talk for a number of years around the community coming together in a collaborative fashion to take a look at building youth wellness, mental health wellness being a part of that. It's very important, whatever community we're talking about, but particularly in my belief in First Nations territories, to locate the Hazeltons. So just quickly, Gitsan territory is approximately 850 kilometers north of Vancouver. We're a very rural community. There's approximately 13,000 members of Gitsan nation dispersed across the world. About 75% of the folks do live within the 6 different communities in the areas. Gittimax is where the United Church Hospital is. It is also the main feed for anything to do with health services in that area. So you'll see the 6 different villages, all which have individual variety of sizes of health services and social services provide, but the United Church Health Services is definitely the catch-all for everything, right from the psych unit, public health, mental health, acute care, long-term care, you name it. Well, also chatting about this area, it's really important to understand, and hopefully you can see the picture here in the background. We've got a Stickinagan, which is a mountain that overlooks Gittimax, and I was told by the people that I was working with in the community that they thought it was very important, this picture, to include, especially for those away and understanding, to see not only the clouds and the storm, which signify the challenges in terms of wellness, but also the rainbow and the light that's coming through. So traditional cultures are very much practiced within the Gitsan area, with Simagets being the Gitsan language spoken along with English. They're taught together in the schools. There's also a wide settler population with a lot of the population of mixed lineage. So the inclusion of Gitsan traditional ways and culture is seen by both the community leaders in Gitsan and the settlers as being very, very important. It's also important to mention, while we're on this slide, that what precipitated a lot of this was in 2006 with, there was, in a period of a month, 100 youth suicide attempts with numerous successful suicides. Our numbers have gone down appreciatively since then. Community health, everybody says, is still not good enough, though. It's got to come lower. We're still having a lot of ideation. I'm moving this the right way. Sorry about that, guys. Social determinants of health. You can't talk around mental health, particularly in Aboriginal communities, without an understanding of the social determinants of health, without an understanding that many of the core mental health issues that you see experienced generationally are direct result of the colonization process. And through my work with community, it became very clear and was repeatedly stated that it will be a decolonization process that will move the people back to a state of wellness and balance. And although there's many examples of health occurring within the Hazeltons, within the Gitxsan territory, there is that understanding that we'd like to move forward. And like an echo of many other conversations this afternoon, thank you to previous colleagues, that culture does matter. In the 28 personal communications and the over, I don't know, probably about 32 different community stakeholder meetings that I was engaged with over the last 3 months, regardless of whom you were speaking to, it always came back to culture. And I just think that is so relative in terms of mental health and the importance that it's playing. These two children are brothers from that area. So there's many definitions out there around health promotion. And I selected for this the Center, through the Center for Health Promotion 1997's quote, because of the fact that it includes spiritual well-being and culture. Spirit was another thing, spiritual practices, and I'm not talking about denominations and such, just that walking in wellness came up repeatedly. So back to the planning for the planning. So my role was really, it felt like investigative and but very, I was welcomed in with open arms, particularly with the elders in their 80s and 90s. And there was many of the youth workers and the youth themselves that spoke very clearly that they did not want to be looked at, that they were less than, that it was a deficit, right? That we were coming from a place of strength and holism, which links very well with mental health promotion. The model that was accepted and is being used to move forward for the actual planning is borrowed. It's from the First Nations wellness model, and this is a model that's being used by the First Nations Health Authority. And you'll notice like the focusing, if you go right into the center of it, you'll notice where the individual is in the center, but the realms of connection and relationship and holism again, and how you can't, for example, in this case, look at youth mental health without looking at the wellness of the community as a whole. And just another saying, a quote from a Gitxsan, one of the elders, we're all connected here, we're all Gitxsan in this place, and that speaks to that holism where they're not looking out. This is a surprise for me. I thought we'd see, okay, we're gonna have the cultural aspects here, and we'll have our settlers here, and there'll be mutual respect and such, but not so much of the blending. And the take-home messages that kept coming out again and again through these meetings is, no, this is not so. This is not how we see it. Thank you. It's community health planning, politics. We've heard it again. Politics was also a huge challenge with this. Navigating, knowing that with community health planning, you're working with a living document. Collaborative approach to the principles of planning. This is This is a picture of a cultural dialogue workshop that we had back in March, I think it was. Equity, inclusion, respect, community development, and asset-based approach come from a place of knowing the communities are the experts. Dream of the way it can be. The first step in any strategic planning process is visioning. Again, challenges, time, power sharing, cultural safety, strengths, holism, supports First Nations Health Authority, supports resilience, and it supports public health understanding. Conclusions, let the people be their experts on it. Let them know they know best. They are the ones that will tell us. Let's use a insider out. And thank you. Wellness lives in the heart of community. And this is what the message is. And yes, we need to build on research. Yes, we need to build on evaluation. But it all starts with the belief that you can and the vision of how to get there. Thank you. Sorry. Thank you for your patience.
Are there any questions? Are there any questions?
When do we eat, probably?
Actually, I have one question, if I may. May I, Mr. Donahue? This is Lynn.
Mr. Donahue?
Okay.
Oh, sorry, Lynn Davies.
Thank you.
Yes.
Why is the area called the Hazeltons, plural?
Well, this is interesting, in fact, that I was actually surprised it would. I have very many learnings for this. I thought I was going to go in. Even on the title slide, I had 8 different elders tell me I was going to have the whole name because it's Gitxsan territory in Gitxsan language. And they said, no, Leisha, you're missing it because of the fact that we are blended here. Everybody who walks the traditional soil of Gitxsan territory breathes and lives, and therefore we're all connected. We all belong. And and I'm thinking, why the Hazeltons? And they said, well, you know what? We all live together, and if that's what some of the settlers want to call it, that's what we'll call it. We know the name of it, and we're good with it. Okay. Lots of learning, but thank you. Yes?
Let's turn it off.